Hi, I'm Joan the Skin Guru, and I want to talk to you today about psoriasis. This is a chronic inflammatory skin disorder, and anyone out there who's got it needs a big hug. So, what is psoriasis? Psoriasis is where you have red patches of skin that look sore, silvery scales, it's inflamed looking, and you tend to get it on your elbows, your knees, your scalp and your lower back, but it actually can go on anywhere in the body. Okay, so does anyone out there have psoriasis? If so, I'd love to hear from you. 2% of the people in UK, 2% of the people in UK are affected with psoriasis. For me, it's a thing that's close to my heart because my mum and my dear mum, she suffered from psoriasis on her elbows, so I really remember what it looked like, very much so, and the fight she had with it. So I've got to say this thing so that you really remember this. It's psoriasis, although it looks, quite sore and it looks with this flaky skin going on, it is not contagious, so you can't get it from a family member and you can't get it from your partner. It is not contagious. It's important to know that. So what is the problem? What causes psoriasis? What causes psoriasis is the skin renewal system, and what's happening is the skin renewal system in your skin normally takes about 28 days to come up from the basal cell layer to the outside surface of your skin. So the skin renewal, your skin is replaced every, say, 28 days, but in those people that suffer from psoriasis, it's going to take 3 to 7 days, as quick as that. And the result is that you have a build-up of dead skin cells. It's an overproduction of skin cells where those patches are. That's what's happening. So it's a skin renewal system that's at fault here. What are the symptoms? So if you have psoriasis, the symptoms can be, actually you can get it in your nails. You get pitted nails as a sign of psoriasis. Obviously I've talked about the red patches that you get all over the skin, and also swollen joints. If you've got swollen joints, that can be a sign that you're suffering from psoriasis. These are things you need to look at and think, have I got any of these, and get it checked out. Okay, so what causes psoriasis? So I've mentioned the skin renewal system, but what actually causes that to go into hyper mode, to hyperdrive? The thing that causes it is like an autoimmune disorder. So it's your immune system that's at fault. Like so many things that we get, it's the immune system that's a problem. Now, the immune system in the body is to fight against disease and infection. That's why it's the body's defense mechanism, the immune system, and something has happened to the immune system to cause it to have this effect of speeding up the skin cell renewal and this overproduction of skin cells. Okay, so what are the triggers for psoriasis? Psoriasis can be triggered for a number of things. One of the things is, the major thing I've just talked about, is the immune system. You've got a lack of vitamin D, okay, a lack of vitamin D deficiency, which is one of the immune system things that you need. You need vitamin D to have a strong immune system. Stress, if you suffer from stress. If you're a smoker, another huge reason to give up the smoking. Over alcohol consumption. Anything that has an effect on the immune system. So stress, smoking, over alcohol, foods that actually are toxic to the body, okay, that kind of thing. If you're very overweight, these are all triggers. And I think one thing to remember is, if you've suffered from a sore throat or a skin infection, that can trigger it. So a number of things that can trigger psoriasis. Who's at risk of having it? I mentioned stressed out. If you're stressed out, if you're a smoker, drink too much, that kind of person, or young children who are very prone to sore throats, they can get it later on. If your parent has got it, it can be passed down, genetics. And what can you do for treatment? What can you do for psoriasis, right? The first thing I would be saying is get some vitamin D3. Get that into your system to build a strong immune system. So this is the one that I take, vitamin D3. I take 2 of these. This is 2,000 units. I take 2 of them, which is 4,000 units. I would say right away, get this and even, you know, go up to as much as 10,000 units, between 5 and 10,000 units, to really get the immune system kicked up. I think that you have to think about doing yoga or things that's going to de-stress you so that you're not suffering from stress. I think it's important to, obviously, the lifestyle changes. It's all about getting the lifestyle right for psoriasis. Okay, one of the things that I would like to talk about, I've mentioned nutrition, but there is a homemade cream that I would think that would be a good thing to look at. And if you took shea butter, bought some shea butter, coconut oil, and mixed it with a few drops of geranium essential oil, mix that up, and you can put that onto the skin, the sore, if it's sore and inflamed, that's going to soothe the skin for you. But I do think number one is the diet. I want you to look at the keto diet, okay? I think that's a really good thing to look at. Low glycemic index, this type of thing. Look at the keto diet. Google that, because I do think that you are what you eat, and that will massively help if you get that nutrition right. You're halfway there to fixing out your psoriasis. You are. So mentioned the quit smoking, stress. If you'd like to speak to me, please feel free to email me. My email address is below, joan@jlformulations.com, or any other skin condition. I'm here to help you get you back to normal, healthy skin. If you enjoyed this video and found it informative, please listen again to the next one and put your comments below. Thank you. Bye.